Could I ask you, Dr. Dello Russo, what happens with the other 2%?
They die. No. The other 2%.
Hold on, I got to stop you.
Go ahead.
Do it with your face.
So whatever, yeah, go
Yeah,
ahead.
we have speed, so if you can repeat that question again, we'll go for it.
What happened to the other 2%?
Dr. Dello Russo, may I ask you, what happened to the other 2%? What happens with the other 2%?
The other 2% are people who are close to 20/20, but are still left a little bit nearsighted.
Just how important was the role of the New Jersey Eye Center in the testing and the gaining of approval for the excimer laser by the FDA?
Right. The New Jersey Eye Center played a very significant role during the national trials that took place between 1991 and 1996. In fact, more laser procedures were performed here at the New Jersey Eye Center than in any other center throughout the United States. The data that we presented to the FDA, we presented an enormous amount of data from the New Jersey Eye Center, and it's probably pretty safe to say without our data, approval never would have occurred.
Why do you think this happened?
Why do you think what happened?
Okay,
What kind of question is that?
I understand that.
Could be marketed. That's all.
I understand. Okay.
Good.
I understand that over the past decade, you are probably the most experienced PRK surgeon in the tri-state area. Can you explain this?
Well, doing the clinical trials, okay, the New Jersey Eye Center, or myself basically, perform more laser surgeries than any other surgeon throughout the entire nation. Therefore, obviously, I perform more than any other surgeon in the tri-state area. And that I'm quite sure of up until 1997. But then again, this is 1998. Who knows what's going to happen?
You were 1 in 10 of the original primary investigative sites in the country.
Right.
Dr. Dello Russo, have you taught other laser surgeons how to perform a PRK?
Well, the New Jersey Eye Center, doing the clinical trials.
Try that again.
Yeah.
Just had somebody walk behind the picture.
Okay.
Sorry, no problem.
Doctor, have you taught other excimer laser surgeons how to perform PRK?
Yes. Actually, the New Jersey Eye Center became a center for teaching of the excimer laser procedure. We taught hundreds of ophthalmologists from throughout the country about the procedure, how to do it. We also had international refractive surgeons visit us, compare notes, as well as the fact that I worked very close together with the actual inventor of the excimer laser, Dr. Trokel. We collaborated together here from 1991 to 1996. And as also, what I did as well is that I published articles teaching about our results in trade journals, professional journals. I spoke at local meetings, national meetings, international meetings for all those 5 years, 6 years.
How critical is it? I'm picking up every once in a while, like a little bang down there, fire on that side.
A little color. No?
It's not
Is it
damaging.
obvious?
I mean, you hear something very subtle. I mean,
Okay,
it's not
subtle,
infringing on what he's
yeah,
saying.
If it's subtle.
Right. It's not like a blatant, you know. Yeah. Okay, sorry.
Doctor, it is generally acknowledged that the FDA would not have approved the Vizx excimer laser if it hadn't been for your excellence.
Well,
Is there truth to that?
there probably is some truth to that, because you have to remember, the New Jersey Eye Center was the most active of the 10 laser centers that were participating in the national trials. We submitted like about 25% of all the data that the FDA required prior to approval. And I guess if we didn't submit such good data, such excellent data, maybe approval would have been delayed, or maybe never would have occurred. I don't know.
Why does the Vizx excimer laser systems name you the pioneer of the excimer laser?
Well, that may truly be an exaggeration. They did do that, of course, but that may be an exaggeration. I think there were several reasons why they did so. Number one is the fact that I was into the laser surgery very early on. I collaborated with the inventor of the excimer laser, that is Dr. Troquel, for so many years. We performed so many procedures. The excellence of our results during the clinical trials. That's probably it, yeah.
Why do you think this is important to patients?
Well, I think what it means is that we've been performing this procedure for about, I've been into it for like 10 years. Been performing it since 1991. This means that I, my staff, bring to a prospective patient a lot of experience. I think experience is extremely important.
Okay, I'm going to stop taping.